Hi, my name is Zyra Wong Lara. I'm a master's student for the Department of Special Education at Arizona State University. And my applied behavioral project was on looking at the effects that BST taught DRA procedure for decreasing jumping up behavior in a companion dog. So my research question was, will behavioral skills training to teach the participant Mickey's owner how to implement a differential reinforcement for alternative behavior procedure for sitting, decrease Mickey's jumping up behavior when someone enters their home. The rationale is jumping up, especially in larger dogs, can be hazardous. It may knock someone over, especially if it's a child or someone who's elderly. And accidental scratches may occur as well. The participant was Mickey. He is a 2-year-old standard size golden doodle who, when standing up, is about my height, and I'm like 5'8". So the setting for BST training and both the observation sessions that occurred for this project were conducted in the participants' entry foyer that consisted of the entryway and then a staircase nearby. And the social validity is that decreasing this behavior would increase Mickey's quality of life, since given his size and energy levels, it has limited to where he can go and has also become a hazard to the owner's elderly family who come to visit. Previous research by, I'm going to butcher the name, Fafalski in 2019 demonstrated that behavioral skills training to teach a non-contingent reinforcement procedure effectively taught owners to implement with the intervention with high integrity, and was able to decrease same target behavior of jumping up in 3 out of 4 participants. And then a review by Holland 2017 found that implementing additional reinforcers in DRA for dogs, that the treatment of the problem behavior can have unintended consequences that may target problem behaviors to become more resistant to extinction. So those two really gauged into what this project ended up being. So my method for my research design was an ABAB reversal design, but initially hoped to have a multiple baseline design. I pivoted due to not being able to do across participants, of making sure I had consistency within 3 different people to come to the home for Mickey to be able to generalize across participants. So I instead pivoted to an AB design and focused on times that the owner usually had people coming over. So data was taken across a variety of different individuals. The dependent variable was jumping up on visitors' home, entering the home, and it was definitely defined as any time that Mickey had 2 front paws off the ground and having at least one paw touch above the waist on the person. The independent variable was the behavioral skills training taught differential reinforcement procedure for sitting with his owner. Data collection was frequency counts over that were taken over 10-minute observation sessions, since that's about how long it would take Mickey to kind of settle when someone entered in the house. So baseline procedures were and individuals entering the home were instructed to treat Mickey as they normally did prior to any intervention entering. And then for the second baseline, reminders were posted, as well as notified prior to them arriving to just remember to treat Mickey as they had before the intervention was taking place. And then after the first initial baseline period, between the 6th and 7th session, was when I conducted BST training with his owner. That incorporated oral instruction, just letting him know, hi, this is how the procedure should go, having Mickey, commanding Mickey to sit with palm up, and then once he was sitting, provide him with social reinforcement and instructing whoever was visiting, they can now provide attention to the dog by calling out his name, getting down to his level, giving him pets and loves, what he was really seeking for. And then we did some role playing with feedback in between that. I then modeled what it should look like, gave time for feedback. And then when it came time to everything, I actually left the home for like 20-15 minutes to give Mickey enough time to remember, have time to kind of settle back in for the owner then to practice with myself as the person entering the home. And once the owner was able to implement the procedure at 85% accuracy, we were able to move on to the intervention phase, which occurred in the following day. So for intervention procedures, Mickey's owners are instructed visitors to ignore Mickey when they entered, while the owner instructed Mickey to sit. Once Mickey was sitting, they would then be able to provide him attention. Between the second baseline and the first intervention phase, I did kind of check in with the owner to confirm that he was still able to implement the intervention. We did not need a second training session. It was just kind of a check-in reminder, and we would proceed to the next intervention phase. So in our results, the initial baseline phase was taken across 6 sessions. Just want to make sure I had a stable rating of kind of how often Mickey would jump up on when someone was entering the home. And he averaged about 5.33 jumps per person, varying between 5 to 9 jumps in those 6 sessions. The second baseline, which was taken between 3 sessions 10 and 12, he averaged about 5 per session, so there's a nice replication there. For the intervention phase, following the BST training, breaths were kind of taken between 3 sessions due to the time limit in this project, but still enough to get accurate, decent data. So for that intervention phase, he averaged 0.66 per session, with just jumping up twice in that first session and then decreasing to 0 in the second 2 sessions. And then for the second baseline phase, it actually decreased to an average of 0.33 per session, with that first session being 1 jump and then the remaining dropping down to 0 for the following 2 sessions. So these findings suggest that BST taught DRA procedure effectively decreased jumping up when someone enters the home. And then just looking at the graph here, you can see the first 6 data points for baseline. We had a really big jump and that kind of leveled out to be between 5 and 6. Then following that first intervention, decent decrease down to just 2 and then down to 0. With the reversal of removing that intervention phase, we jump back up still lower to 4 and then 6 and 5. So similar to the first baseline, and then implementing intervention again, we drop back down to 1 and then 0. So for discussion, the findings of this project suggest that DRA and right-touch intervention taught via BST to dog owners can effectively decrease jumping up behavior. This is important for future treatment interventions, and a research project aimed at decreasing problem behaviors in dogs, such as jumping up, and more importantly, that, at least in this case, making sure that the function of the behavior matches the type of DRA that you're implementing. So in Mickey's case, it was attention-based, so we focused on limiting the attention to the problem behavior and reinforcing appropriate behavior, such as sitting. One limitation to this study is that it did not incorporate generalization, since only one of the owners actually participated. It's the one that works from home due to just time and being able to train check in. So future work should look at, so also focus on owner having to be present to implement intervention. Future research should look at being able to generalize the commands to others entering the home that the dog is familiar with. So it also includes, like, this intervention did require the owner to be present when someone entered the home. In this case, that's not always it. Owner tends to have kind of an open door policy for people to just come through. So that was something that I consider a limitation to kind of being realistic and being able to generalize and maintain. So would want to look into, like, the maintenance factor for this intervention. So yeah, that's it. I actually it was fun to implement and learn, and being able to teach my friend who was the participant in this project kind of uh different applications for ABA, and was really cool to see like how effective and how quick of a learner Mickey was, because even in the second baseline phase, we noticed, well, I observed that Mickey actually calmed down sooner than in the first baseline phase and began to sit on his own without the owner even being present, which was really interesting. Um, so yeah, this was a really fun project to do. And